Have you ever thought about the chemicals that keep you clean? When you put hand sanitizer, when you wash your dishes, when you fall down the stairs because sometimes there is an extra step that you never notice. How do you clean the womb? Well, there's a lot of chemicals that we know that could do that, all because sometime in the past, scientists experimented with a lot of substance. They discovered the properties of materials that they consider work of the researching. This was the case of Justin Lister, a surgeon who changed the way of working in the field of antiseptic surgery. Lister was a renowned doctor. He was present in the first surgical procedure that used anesthetic in a patient and became a fellow of the Royal College of Surgeons. He married Agnes Syme, the daughter of his professor James Syme. Later, he started working as a professor of surgery. In his time as an academic, he became really interested in the work of Pasteur on microorganisms and sterilization methods. He especially liked the idea of exposing the womb to chemicals in order to avoid war fever. For the ones that doesn't know what does that mean, imagine getting out of a surgery. Everything went perfect. It was the best operation in the world with an impeccable technique. You will imagine that nothing could stop you from now on. Wrong. When you exit the operation room, you still have a big possibility of getting a postoperative infection and die. This was really common in the 1800s. Well, returning to the main story, Lister experimented with carbolic acid, also known as phenol. Nowadays, it is used for the manufacture of plastic and nylon. It's contained in cigarette smoke. Even if it sounds dangerous, and it is also used for a ton of medicines and antiseptics. Okay, so Lister had his patient, he has a wound, he had the substance, but now he still have a major problem: how to apply it. If the phenol had direct contact with the skin, it could have a bad repercussion to the body. Remember, phenol is a toxic substance and could kill you, so he had to take some precautions. He developed what it is called a Dunking engine. It looked like a smoke machine with 4 long legs, which, when pumped the handle up and down, it produced a mist of phenol into the air. It helped not only to clean the surface of the body of the patient, but it also disinfected doctors and their equipment they work with. Even though it wasn't the best way to maintain the safety from germs, kept a ton of patients safe from having complications from the postoperative period. And now, you know a little bit more about what keeps you clean, so the next time you wash your hand, smile, because you're using technology created from a lot of scientists, and try and error.